Hey everybody, Dr. Tam here. You know, there has been a huge misconception of the difference between neuropathy, which is pain tingling going down the legs, but it's mainly in your feet and in your hands, versus a pinched nerve or sciatica in your lower back. Now, here's the difference. People who have neuropathy in general usually have a few things. You got to find out what the cause of neuropathy actually is. And there's a few causes. The first cause of neuropathy is diabetes. Almost 70 to 80% of people with diabetes will end up with some form of neuropathy. Number two is there is chemo-induced neuropathy. There is also going to be your idiopathic neuropathy, where no one knows why you have neuropathy in the first place. There's alcohol-induced neuropathy. It could be induced from different medications, right? It could be something from spinal as well. And with all the forms of neuropathy, you got to find out what the cause of it first, because we have patients that will tell me, well, you know what, Dr. Tam, I've got diabetes, or I've had chemotherapy, right? We have patients that within about 6 months to a year of getting chemotherapy, they end up with some form of neuropathy. Well, then there is people who have a pinched nerve where they thought it was neuropathy, or they got somehow diagnosed with neuropathy. We've tested people before and it's like, you don't have neuropathy. You have a severely pinched nerve in your back. But because of the symptoms that they describe to their PCP, their primary care provider, primary care doctor, the doctor never really took any further look into their back because, well, their back didn't really hurt, but they have butt pain, or they have pain going down the upper thigh sometimes, right? So it's very easy to misdiagnose neuropathy for a pinched nerve, or a pinched nerve to neuropathy. And that's why in our office, when we take care of a patient with neuropathy, number one, I'm going to sit down with you through a thorough exam consultation to figure out exactly what is the cause of your problem. How is it affecting your life, right? What is it preventing you from doing? There's the day-to-day activities, right, that it stops people from doing. Maybe you're not able to walk as quickly as you thought you wanted to. You can't go up the stairs the same way. You get really tired and fatigued. And now you don't want to do anything. We've had patients with neuropathy that tell us where they've given up on certain activities between what their friends are telling them to do, what their family members are telling them to do, and they just don't do it anymore, you see. So how do you diagnose the difference between neuropathy and a pinched nerve? Well, you got to take yourself through a neuropathy test. We do a 17-point neuropathy exam in our office, and if we feel or suspect that it is not only neuropathy, and sometimes it could be a combination, then we'll absolutely take x-rays to see if there's pinched nerves in there as well. I hope you learned a lot today about the difference between neuropathy versus a pinched nerve. Another difference, I'll give you a bonus tip. Neuropathy rarely goes from the lower back to the glutes and hips to the butt and then down your legs. That's more likely a pinched nerve. Neuropathy most of the time goes from the feet or the hands up. It goes the other way. It goes from the outside of your body towards the inside, whereas something that's pinched nerve usually goes from the inside to the outside. Hope you learned a lot today. All right, until next time, take care, everyone.